Once we saw the success from what we were able to do with COVID, we expanded to a 30-day discharge program and a 12-day discharge program, which went with low and medium risk readmission patients. We were able to reduce that 30-day readmission rate fairly significantly in both our 30-day and our 12-day programs. And we've also, with the COVID flu, RSV epidemic that we're experiencing, we expanded to a bronchiolitis program for the kiddos. And this has been a really cool opportunity to see the parents be able to engage with us.
During COVID, a lot of the feedback we were getting was that people just felt less alone. A lot of people said they just felt better knowing, there was someone there. If something happened to them, we would call them, we would check on them, we would see that they hadn't responded. And we also have seen a reduction in our readmission rates, which is great. We're able to follow up with the patients. They're able to receive education. A lot of the questions that are tailored to if they have their follow-up appointment, if they need help with transportation, if they have their medications, those are a lot of common issues that cause patients to be readmitted.
I think within our pregnancy and postpartum support program, we see so much anxiety and depression. And so the ability to embed some questions kind of related to how is your mental health? How are you feeling? Then to be able to set them up for success in the future, I think is so valuable. And maybe for some, like if you asked them that in a clinic face to face, they wouldn't be comfortable answering it. And so having the opportunity to answer it kind of personally within the loop, and then if there is a need, having a nurse call you and provide you with additional resources or get you to a level of care that you need, I think really has had some good outcomes for our patients that otherwise they might not have had if we weren't here in that way to support them.
Maternal hypertension is something that is on the minds of a lot of providers, and it's something that we're really looking to solve with this type of outreach. So we were able to build in a question asking women to check their blood pressure and send their blood pressure readings into us, which is fantastic. And all of the women that enroll in our program get a blood pressure cuff at home, and are taught how to use it. So I think that's been another great thing that we have been able to accomplish through the loop. The story I have in mind is a patient, again, she got involved with us probably 30 weeks pregnant and was very interactive in the loop. A lot of chatting, checking in frequently. She did go on to have a healthy baby girl, full term. And then about 8 days postpartum, she reached out with a severe migraine headache, something that she had a history of. But my nurses knew immediately that that's not normal. So we were able to reach out to her, ask her to check her blood pressure. Her blood pressure was very elevated. We did call her and get her triaged and sent her to the emergency department. And she actually did get diagnosed with severe preeclampsia. So I just think this is just another great way that we can, help moms monitor that at home and make sure that they are getting the care that they need, because that is one of the main reasons for morbidity and mortality in pregnant and postpartum moms. So it's just another great feature of the loop.
So within our discharge programs, we support a lot of patients across our ministry after they leave our hospitals. And engaging them in the loop has shown a decrease in our readmission rates to our hospital. For our highest risk patients, we see about a 10% decrease in our readmissions in that area, which really is incredible. We are looking forward to kicking off some continued work in that area to expand, to increase our activation rates, because the data really has shown the impact that the service has in that population.